we need help.
Yeah, I'm gonna do what I normally do, is ask you to call my cell phone if you do run into trouble.
All right. Oh, okay. I think I have it queued in my cell phone. Okay, everyone, we have a quorum, and I'm about to begin the meeting. We have a guest. She will introduce herself, but I want you just to mention who's ever on the committee besides myself as chair, who you are. So I know I see Cynthia and Jeanette. Go ahead. Cynthia, you want to introduce yourself?
Hi, I'm Cynthia Rodriguez, and I am here on the Health and Social Services Committee. Happy to be here. Thank you.
Thank you, Jeanette.
Good evening. I'm Jeanette Wilson. I'm also on the committee, and I am happy to be here tonight. Welcome, everybody.
Thank you. All right, Travis, you want to tell a little bit about yourself?
Yes, ma'am. My name is Travis Thomas, and I am here from Disrupt, and also my partner Karen Allen is also on the line, and she's from Disrupt too as well. So we'll be doing a presentation on Disrupt clinical trials, as well as Save for Life Cancer Corporation's Cancer Resource Station. Happy to be here. Thank you so much for having us.
Right. We do not have the minutes for the last meeting. Joanne will get them to us and we could look at them, but everyone could look online. I don't know if you want me to read the whole code of conduct or not, because I think most of us know what it is, and hopefully everyone will obey the rules. Please let the speaker speak first, and then we will have a Q&A. All right, Travis, I'm letting you begin. Travis?
Yes.
You can begin.
I couldn't hear you. Oh, okay. Thank you so much. Appreciate that.
You're welcome.
Okay. All right. I am. Okay. Mr. Jeremy, is there any way that you could share? Is there any way that you could share the slides that I sent you?
Jeremy? Oh, he may be gone. I may have to try to get him. Hold on. I didn't think.
Okay.
Just give me a moment. I have to go get it on my phone.
That's okay. Thank you. I appreciate that. Oh, I did email him to let him know too as well.
Jeremy, oh, nobody said to phone him, so that's what I'm doing.
Okay.
Jeremy, Travis needs your help, so she wants you to.
All right, hold on.
Travis, do you see the option to share your screen anywhere?
Okay. Let's see.
I don't think she's used to our thing.
Travis, on the
Okay,
bottom
I
of
could
the
try.
screen, there are
Yes, I
three.
try.
On the bottom of your screen, you should see mute, stop video, and next to stop video, there's an option to share. You could try that.
Okay.
That's the one with the
Alright.
circle and the
Yeah, you
Plus in
see on the
between.
bottom of this, are you on a
Okay.
laptop?
No, I'm on my computer.
Okay, well, either one, at the bottom of the screen, like they're saying, you see mute, start video, share. See share?
Okay. Okay. I tried this one time before. Wasn't too successful with it. Okay, I'm gonna give it another shot here. Okay.
Yeah, you might want to stop your
So-
video too. Looks like you.
Good.
Yeah, she's not used to this format. She's used to doing
Yeah.
Zoom.
Let's do that first. All right. Thank you so much.
Yeah, it seems like your Wi-Fi
Okay.
connection's not good.
All right. So now what I'll do is I'll share my screen again. Uh-oh. You can't hear me well? I'm sorry. Can
Yeah, I
you hear
mean,
me?
we can hear you. I'm just saying that your connection's not the greatest, but,
Wait,
but
okay.
keep trying.
Keep going.
So where you see the
Okay.
share button?
All right. See the dots, the three dots on the side? Oh,
What?
no, I see the share button at the
Share
bottom
button.
of the screen. Mm-hmm. Okay. Got it. I see it. All right. So, all right.
All right, what's
Okay.
the next
Make this
step?
work now.
So
Okay.
after she clicks that, she gets to, if she has the document open, she can select the specific document, or she just shares her screen, whatever she's comfortable with.
Okay. All right. Let's try it this way. Okay. Let me see.
It's starting to
I'm
share.
learning some.
Is that okay?
Yep, that looks, I don't know if you can
Yeah, I
maximize
got
that.
it now. I guess
Okay.
we got the first page.
All right. Okay. Make that bigger, right?
Yeah, that's smaller
Too big?
actually.
It's smaller?
No,
Yeah.
it's not that small.
Okay.
I could make my screen
Okay.
larger.
Yeah, I mean, it's large enough.
It's large
And
enough.
it's up to you. It's up to you, Sandy, and the rest of the
No,
committee.
it's
huh?
fine. I could read
Yeah.
it. Is anyone else having a problem?
Is that
No,
better?
it's fine.
Like that?
It's fine.
It's fine. Don't even
This is
leave
good?
it as it is.
Yeah, that's perfect.
Okay.
That's perfect.
That's good?
What you get?
Okay. All right. Excellent. Okay. So let's go with that. So when I get ready to turn the pages, all I have to do is to just, just one click and that's it, right? And it'll turn.
Yeah, it's
right?
just we're seeing what you see. You just gotta do what you gotta do with your screen.
Right,
You
thank you.
want to test it? Try to go to the next
Right.
slide and then go back.
Okay. Okay. Yep. All right. So I'm gonna read this one, and then we're gonna go ahead and see if it works like that. Let's try that first.
Okay.
Okay. Thank you. Thank you so much. Thank you so much for your patience. We are very, very excited to be here to be able to have this opportunity to do this presentation for Community Board 11. Thank you. Thank you. Thank you so much. We appreciate you and your time. Welcome to our Disrupt presentation to make cancer research equitable. My partner is Karen Allen, and she's a retired military veteran and educator, oncology research citizen scientist, and I'm Travis Thomas, an oncology research citizen scientist, holistic cancer life coach, and oncology patient navigator. I will begin the presentation and then Karen will join in. Okay.
Okay.
Good. So far, so good. Okay. All right. Our mission, Disrupt, aims to reduce the cancer burden and cancer health inequities that affect approximately 2 million people living in some of the most diverse and underserved communities in the United States. Okay. What is Disrupt? Okay. The Disrupt Project works to raise awareness about the need for diverse representation in cancer research and find the best ways to remove barriers. Inclusion of diverse groups of people in cancer research is essential for health equity. Cancer statistics. The American Cancer Society estimates that in 2023, 1,958,310 new cases and 609,820 cancer deaths are projected to occur in the United States. Cancer is the second leading cause of death in the United States. According to the National Cancer Institute, NCI, men have 1 in 2 chance of being diagnosed with cancer during their lifetime. For women, the chance is 1 in 3. The coronavirus disease of 2019, still happening, pandemic caused delays in the diagnosis and treatment of cancer because of healthcare setting closures, disruptions in employment and health insurance, and fear of COVID-19 exposure. Why the Disrupt Project? Some of our goals are connecting with community to share information that demystifies clinical cancer trials and why being in one may save your life. Teaching how individuals with cancer can better advocate for their cancer treatment and providing support to individuals, families, and communities in the Washington Heights area, Inwood, Northern Manhattan, and Bronx neighborhoods. What are clinical trials? Clinical trials are research studies that test how well a new way of treating, detecting, or preventing a disease work in people. Clinical trials may or may not provide direct benefits, but they can help researchers and doctors find targeted treatments for others in the future. Karen?
Sorry, I forgot to unmute. Hello,
okay.
everyone. So
Hi.
I'm going to share a little bit about characteristics of clinical trial. Usually medical or clinical studies constitute the last step of research. Human subjects volunteer to participate. Then they last about 5 to 7 years. I can attest to that. Investigations are carefully conducted following the predetermined research protocols. Protocols are very important when it comes to clinical research. Approval of relevant governing and ethical committees is essential. Most of the time when they have protocols for any trial, they're explained to the patient, the family, so they will understand what a protocol is. It's the lineup of the medicine and everything they decide to share with you so that you will understand about the trial. Very important. And is usually approved by the government and ethical procedures or committees from the medical field. Okay, we can move to the next slide. Okay, community engagement around cancer clinical trials is the first aim of the Disrupt study. Why is it important to start a new dialogue about cancer care and medical research with communities? For one, in all fairness, cancer requires personal treatment options. Knowing your options early to begin the discussion about cancer research is best. Individuals' decisions, beliefs about cancer and cancer research matter. Medical research and researchers must become more visible, accessible, and accountable to maintain trust. This project will attract organizations to engage with researchers. Cancer, unfortunately, is widespread, so there will be many opportunities to share information about the importance of research with family, friends, networks when the cancer, I don't see the last word.
Becomes a concern.
Yeah, becomes a concern. That last, the bottom, I can't see, Ms. Travis. I'm sorry.
Can't see it? That's okay.
Okay, you can move to the
Yeah.
next page.
Mhm.
I don't know why I can't see it, but all right. So it's understandable that people of color in the United States are suspicious about medical establishments given prior abuses, unethical treatments, which were racially targeted. Henrietta Lacks, Tuskegee experiments, forced sterilizations, infectious diseases inflicted upon indigenous communities starting in the 15th century. An unequal healthcare system as witnessed during the global COVID-19 pandemic. There are no ethical standards for medical
research
and
and
no
no monitoring.
monitoring research conducted.
Sure. Okay. Is anyone familiar with some of these clinical trials?
Yes.
Have you heard of it before? Excellent. Okay.
Yeah.
Yeah, most of them, and most of the stories are also on YouTube.
Okay. You'll be able to see more information about them on the website too as well.
Yeah.
All right.
What are some of the common myths about clinical trials? Clinical trials are not safe. They cost too much for the patient. Research studies are just trying to do the work of big pharmaceutical companies. Patients are being used as guinea pigs. The research information will be shared with government agencies.
Okay. So let's start talking about common research study types. Okay. First, we have just up a little bit. Okay, just to help you understand a little bit better. We have the randomized control study, where an investigator assigns exposure and compare rates of outcome in two groups. For example, the University of Toronto study, flaxseed's effects in patients with breast cancer. 30 women diagnosed with breast cancer participated in this study. All of them were scheduled for surgery. 15 were given muffins with flaxseed in it. 15 were given muffins without flaxseed in it. They had to take one muffin a day. The women who received the muffins with flaxseed, breast tumor had shrunk significantly, but the other women's tumor remained the same or grew slightly. Another study design is the prospective cohort study. This is where an investigator identifies group of people and compares rates of outcome in exposed versus not exposed. Participants report exposure can take 10 to 15 years. For example, tens of or hundreds of thousands of people who are cancer-free will participate in this study. They might fill out a questionnaire of potential risk factor. Often, they might give blood samples. After many years of follow-up, we will have enough people to compare disease rates in people who have a potential in risk factor and those who don't. We would be comparing genetics, lifestyle, behaviors, environmental, medical history to identify factors associated with cancer. Next, let's discuss the case control study. It's an observational study. Investigators compare two groups of people, those with the cancer under study and those who do not have cancer. For example, the University of North Carolina at Chapel Hill, Department of Epidemiology, investigators conducted a study to determine if there is an association between colon cancer and a high-fat diet. Cases were all confirmed. Colon cancer cases in North Carolina in 2010. North Carolina residents without colon cancer participated in this study. The ratio odds tells us that individuals who consumed a high-fat diet had 4 times the odds of colon cancer than individuals who do not consume a high-fat diet. The study compared people with the disease of interest, which is cancer, community or population. Using questions or resources, both groups are asked to recall their exposure history. Let's talk about the correlational studies, where investigators are looking for a relationship between two or more things, variables that naturally occur in the same environment. An advantage to this study, we can learn about relationships between two or more things. We can get a lot of information about a large number of people. Another study is a longitudinal study, where investigators are following one group of people across the time measuring the same. Advantage to this study can allow us to pinpoint a specific time changes occur. Okay. These studies provide information about how people develop over time. Now, the study that everybody has an idea about, and I've heard of before, is the experimental studies. These control studies allow researchers to manipulate one variable to determine its effect on other variables. An advantage to this study allows us to look at cause and effect relationships. Now that you've learned about different studies, know that participating in a research is truly important. It's not just about experimental studies. There's different ways you can participate through questionnaires, through surveys, even participating and donating blood in particular studies, or having them follow up a study throughout the years. So these different studies can help save lives. And me and Karen Allen wants you to know about different types of studies that you could participate in or talk about and discuss with your community that can help save a life. Karen, can you see?
Yeah, I see it. My screen's a little different, but I got it. Okay, clinical trials today. Inform, I'm sorry,
It's okay.
informed consent needed and ongoing throughout the study. A research team is available to answer all questions throughout the study. Participants learn about study goals in addition to what to expect through your trial journey, risk and benefit. Individuals are also informed that the study is for research purposes and trial drugs may not work. Each person is free to withdraw
Mhm.
Each person is free to withdraw at any time without any penalties, and your current medical care will not be affected. Very important. Okay.
Excellent.
And next slide. Oh, there you are.
You, Miss
Okay.
Allen.
That's okay. So my story, my name is Karen Allen, and while I was in the military, my first experience with a clinical trial at the time was with my daughter. She had been diagnosed with neuroblastoma, stage 4. And during this time in the military, there was a trial for oncologist bone marrow transplant, where they cleansed her blood and put it back in her system. Before that, she was treated with chemotherapy and radiation, and then the oncologist bone marrow transplant was the next part of the protocol. While she was in the study, everything was explained to us. It was experimental, and unfortunately, it extended her life for 2 years, and she passed away. During that time, I learned a lot about cancer in the studies. And about 2 months after her death, I was diagnosed with breast cancer. So while I was diagnosed with breast cancer, I learned a lot from her her protocol and the clinical trial that she was in. And I was approached with a different clinical trial at that time. I was 30 years old and I had a lumpectomy. I was the third in the military to have that procedure done, followed with chemotherapy and radiation. I successfully had 29 years cancer free. And in 2018, my cancer returned. Different type. The first time it was carcinoma of the breast, second time it was HER2. However, there was also a different study approach at that time. So for me, clinical trials, even though I had the tragedy in the first one and it was devastating, I had to learn to have hope, and I had to learn about observation. I had to learn about educating myself and perseverance in order for me to still be here at a young age, learning these things. I also learned the advantage that I had in having the experience with different doctors and different trials. That's why I definitely believe in Disrupt. I believe in what we're doing, and I think that clinical trials are important. um, the advantage that I had was after the first chemotherapy, I was able to have another child, and I have two foster daughters. I was able to raise other girls, and we participated also in a genetic study. Over all these years, NYU kept up with my tumors. They let me know how everything's doing in letters. So the studies were beneficial for me and my family.
Mhm.
So we can move to the next slide.
Next.
Mhm.
So here is actually another family member. This is my nephew, Anthony. Anthony needed a kidney transplant, and he also participated in a clinical trial here at the Chrysler Building in Manhattan, where they studied the transplant patients, and they participated in a trial with medicine that would help them after their kidney transplant. Anthony is doing fine. He remarried and he's moved on with his life, and he's still in a clinical trial study where they study him every year and to see how he's doing. And he has been out of the clinic 13 years now and doing well.
Excellent.
Excellent.
So we appreciate you giving us this time and having this opportunity to be able to talk to you about Disrupt. And me and Karen Allen teamed up together because we know how important it is. I'm a 3-time cancer survivor while pregnant twice, and my daughter also had cancer. And so, us coming together to let you know that this is important, is needed, the information is needed, and educating our community is needed, is something that me and Karen are very, very passionate about. It's also something that Disrupt is passionate about as well. So we also have some of our research team who is on the line as well. If there's a question, we can take a question.
I would like to ask a first question. It's Sandy. How do we find out about these studies? Would your Disrupt group say someone we know has cancer? Would they call you, and could you then direct them to a study?
Yes.
Well,
I'm sorry, Karen. Go ahead. No, you
Go ahead.
answer, Karen.
yeah, I'm excited about this. I'm sorry. We have brochures, and you can actually scan the information, and you put in what you're looking for in the research area. Say, for instance, if you're looking where studies are being done here in Montefiore, Columbia, it would actually pop up on the screen. Can we show the that little scanner? Is it?
Oh, the QR code?
Yes, I'm sorry, I'm saying scanner, but the QR
That's
code,
okay.
everything will pop up, and you type in your information. We were able to help a young lady today who is beginning stages of cancer. So we located a clinic in her area, and we have to actually, the Cancer Navigation, which Ms. Travis runs, was able to find her clinics in South Carolina. But here in New York, the Disrupt community has the QR code on everything, on the swag, on the bags, on the brochures. You scan it in, and the information is there. All you have to do is type in the box what you're looking for, and it will pop up. The information is right there.
Let's see.
Well,
I believe that is at the end. These are some more resources that are available, and I can send you these resources after the meeting is over as well too. Different organizations that provide cancer resources and services and support. So I believe that you are so welcome. I believe that
Jeremy, are
it
you
is
still
at
on?
the end.
All right. Is there anyone else with a question?
Yes, this is Jeanette. First of all,
Go
I
ahead.
just want to thank you very much for sharing your personal story and also for sharing this information. Now, am I correct that you're going to be able to share with us information so that we can disseminate it to our
Yes.
groups and communities? Because
Yes,
I would
yes.
very much like to do this. And also,
you.
is there an option to maybe invite speakers to come to health fairs in the community?
Yes, ma'am. Yes, ma'am. Yes, definitely. We would be able to do that. We have doctors who can come and do presentations and speak about different types of research as well. Here at the end, you can see the website, which is Disrupt Stand Up to Cancer NYC. And that website is www.stopcancernyc.org. So you can go to the website and put whatever type of cancer in on that website where it says search, whatever you're looking for, the cancer or whatever services you're looking for, you can put it in there and it'll pop up. I put in, for example, if it's breast cancer research that's happening now, if you put that in right now, you'll see all of the research, the different researches that's going on. And then you can click on that and get more detailed information about it. This is the phone number as well, 917-284-8810. That's 917-284-8810. If you're interested in having someone to come out and do, the doctors to come out to do a presentation or to do a discussion, and we have community partners. Disrupt has community partners as well who can come out and talk to you about the services that they provide too.
Thank you very much.
Yes.
You're so welcome. We'll send you the brochure.
Yes.
We'll send you the brochures as
And
well. We'll
you
email
know
it to
what?
you so you can see that scan.
So I am one of the research I'm the program manager at one of the arms of the institutions. And yes, if you want to have
Who is
disrupt, and we could
talking?
also,
So,
oh,
excuse me, who is talking?
That's
mm,
Lauren.
Oh, I'm sorry. That's Miss Lauren. And she's on the research team as well. She helps
Oh,
lead the
okay.
research team also. So she jumped in to share more information. Thank you
Go
so
right
much. I'm
ahead.
so sorry. Yes,
It's quite
so
all right.
sorry. Mhm.
yes. I am one of the program managers at Einstein, and yes, we could definitely do different types of disrupt presentations at organizations, community health fairs, and also we could also have a deeper relationship with any of the community organizations that you want to have a connection with, such
Okay.
as we also talk with LLS, which is the Lymphoma Society, so we could also bring them in if you want more information about that. It's all catered to you and what your community needs are.
Thank you.
Thank you.
Thank you.
You
Thank you
know,
so much.
I have to say this. It was so easy to understand what you were
Thank
talking
you.
about, and you really gave us a wealth of information.
Thank you. Thank you. Definitely. Thank
Thank
you
you.
so much. I appreciate that. Because when we think about clinical trial, the first thing we think about is experiments. And as an oncology research citizen scientist for Montefiore, Mount Sinai, and Columbia Presbyterian, you get to know in details what some of those research studies look like. And I think that we believe that it's very important that you have an idea of what it looks like, so that we won't always think that it's about the experiment. It's about the education, the resources, the information, and the awareness. And all of this together will help save lives and help us to be able to extend the lives of those people who need this information right now.
Yeah.
Oh,
So
True.
thank you
thank you.
so
This is
much.
Sandy. I was in a study with Premarin, and boy, when they found out certain things years ago, they literally told us to stop taking the medication, etc. So clinical trials can be helpful in
Yeah,
so many ways.
definitely. Even the last
Yes.
one, they keep up with you now too. There
Yeah.
may be a lot of paperwork, but they will mail it out. They will send everything to you.
Yes, I know.
Mhm.
And you know what? It only takes a few minutes to answer the questions, but
True.
you're
True.
helping yourself and everybody else. Is there
Yeah,
anyone
true.
else who has a question or
I had a quick question.
Yes.
Hi,
who?
hi. This is Cynthia.
Hi.
I am on the committee. And so just for clarification, let's say I or someone I know ends up with a cancer diagnosis and they want to get more information. If they go to the Disrupt page, they would be directed to any number of options in terms of clinical trials. Is it sort of like a clearinghouse in a way?
It's information about clinical trials. It's information about what a research is. Some of the information is from, Stand Up to Cancer, because Stand Up to Cancer helped with the funding for this particular project as well. And there's other different information that you'll find on there. Miss Lauren, could you also speak on what other information is on the website, please?
Yes, so there's also information about what is a clinical trial, how to enroll into clinical trials, also the end list of resources such as social support or finding clinical trials that's not on the website will also be linked onto the website. So the website is just a very friendly way of getting the information you need in the most clear, concise way.
This is
And
Jeanette.
Thank you.
Do you have support groups for people who engage in the clinical trials?
We do not have support groups, but every institution, so this is a multi-institution project between Columbia, Mount Sinai, City College, and Einstein. And each institution have their own support group. So
nice.
For Mount Sinai, no, Einstein and Montefiore, there's the Bold project where it's also a support group, and there's a support group for Icon also.
Okay, thank you.
Thank you.
And woman
Oh
to
yeah.
woman to woman
Mhm.
for Mount Sinai, that one is for gynecological cancers. There's a lot of different types of support groups out there.
And
Is
when
there
you, oh, go ahead.
Is there
Mhm.
anyone else who has a question or comment?
I'm actually curious because I know you mentioned a number of the private hospitals that are involved. What
Mhm.
about the NYC Health and Hospitals? Is there, um, are you guys linked up with the city hospitals at all?
Unfortunately, we are not. It's only between these institutions, but we do try to our best to connect people who reach out to us to the best care to them.
Thank you.
Okay. Thank you.
And
Thank
and
you
the
so much.
providers are listed too when you go to the page, the community providers, community engagement, whatever's for patients, the educational video, the pilot research, and the contact. So, they probably could connect them even further once they make the contact in their area.
Thank you, Karen. Thank you
Thank
for
you.
sharing that. Appreciate
Hmm.
that. So are there any more questions before we go into our last part of our presentation? No?
No,
Okay.
I'm
Yes.
wondering, but I just have one thought.
Yes,
Do,
Ms. Sandra.
Sandy, do you have brochures that can be left at the office on
Yes.
Colden
Yes.
Avenue? And
Hmm.
maybe that would be helpful too. So
Yes.
that,
Yes. Yes, thank you so much. Definitely. We can have
yeah,
brochures sent to you that you can definitely just distribute to the community as well. And then you'll
terrific.
be able to see that little the scanner that's on the back of it
Yeah, the
that has
QR code.
yes, that QR code that has so much information on it.
I love that
I'm
code.
learning. No, yeah, I'm
You will
just
love
learning.
that code once you use it.
Right.
You got
Okay.
it. Okay, so thank you so much for that. You can hold on for me just a few more minutes. We're almost done. And did you want to add something to that, Miss Allen, before we jump over to the
No,
next
no,
one?
that was it.
Okay.
We
Okay.
want to get things out to them as quickly as possible.
Thank you. And Miss Lauren,
Thank
did you
you.
want to add something before we end this part?
No.
No? Okay. All right. So, y'all are just fantastic. I did not have one problem. So far, so good.
Don't give, just keep going.
Just keep going. Let me be
You gotta
quiet.
wait till the end to say that.
Be quiet. Okay. So we're gonna go into our second part of the presentation, and okay, let me see right here. Okay, and let's see now. All right, I think that I can do this one. Okay, so this particular presentation is about S4LCC Cancer Resource Station. And S4LCC is Saved for Life Cancer Corporation, which is a nonprofit charitable organization. And Miss Allen's Patty Cake, which is Karen Allen's organization, and Save for Life Cancer Corporation, joined together to create the S4LCC Cancer Resource Station, the only cancer station in the nation, owned and operated by minority women who are cancer survivors and thrivers. Okay. So let me see. All right, let's just shrink that back down a little bit for a minute there. Okay, you can see my whole screen, right? Sorry about that. Let's open it up some. And okay, all right, that's not too much. Not too bad there. Okay, all right, so all right, you know my name. We just had a wonderful conversation. We know each other. We're close to being best friends now. Okay, so anyway, it's Travis Thomas, and I'm the founder of Save for Life Cancer Corporation, cancer life coach, cancer patient navigator, and oncology research citizen scientist. And my partner Karen Allen, and she is the founder for Miss Allen's Patty Cake, and she works with the department for our children's program. She owns and operates that. Okay. We have S4LCC Cancer Resource Navigation Network. We have S4LCC Cancer Resource Stations. And I'm also a part of the National Cervical Cancer Coalition, a chapter leader for the Bronx and Harlem. Okay. All right. As you know, Save for Life Cancer Corporation is a nonprofit charitable organization helping cancer patients, survivors, and their families to have access to free cancer services, resources, screenings, and cancer health information. Over 20 years of experience promoting cancer awareness, education, early detections through radio, television, faith-based cancer patient resource navigation, communities, and schools. The projects that we're working on today are our cancer resource stations are now located in the Bronx, Harlem, as well as one site location in Long Island. We continue to grow our cancer resource navigation network of resources and community organizations working together to help us to be able to have great resources and information for our community. Our Care to Screen 1,000 campaign has begun, where we will have different events and participate in different events to get 1,000 people screened for cancer: lung, skin, cervical, colon, prostate, and breast cancer. We provide services virtual, over the phone, and in person. We believe that communities working together can stand united in the fight against cancer. Cancer resource stations are located in these neighborhoods, the Bronx, Harlem, and Long Island, but we do look forward to coming to other communities as well. Karen? I can't hear you. Can't hear you, love.
I'm sorry. I forgot to
That's okay.
unmute. So sorry. So what Miss Allen's Patty Cake does is educate our youth and our children, elementary through 6th grade, and we plan to expand to high school because students who live in Ronald McDonald houses or St. Jude, sometimes their education is lacked because of the things they don't have. So year-round activities for after-school children living in shelters that need a boost in education. The goal is to help them by creating activities that will actually engage them even more and enhance and support the education system that's already created for them. Students will learn how to have fun, use the educational tools online, and learn how their families and we can support them and learn how to schedule their activities wisely, because sometimes when you're in and out of hospital, it's difficult, to try to get educated. So I provide short packets for them. We plan to expand more than summer or the beginning of the school year. However, it's so many kids, so many different needs. So I try to try to get engaged with each one or whatever the needs are. I try to find out what they need and we send the packets out.
Yes. And even though it's not here, it's not listed here, but we have employed almost 500 youth and young adults
Yes.
in our communities. So we're very honored to be able to provide opportunities when these youth are able to get from 14 to 24, they're able to get different certifications in the medical field, as well as different career certifications to enhance their resume and help them to be a little bit more marketable than they were when they first came with us, but mainly to teach them about cancer, oncology, awareness, early detections, prevention, and help them to become activists and promote awareness as well. So we are very proud of that, to be able to do that.
Yeah. And also, most of them, they're very good at research. I was amazed that many activities that I have now on my site, or they actually were willing and they were very helpful in helping us to educate the youth, the younger kids. They even went out tabling with us. We gave out book bags that, I actually created for the kids, and we designed packets. It was really a great experience. I pray we can continue to educate our youth in our communities and those who are in the shelters that have the different needs to boost their education.
Yes, definitely. Between 3 months, last summer, 3 months, we were able to get 300, we navigated 300 people to free cancer resource navigation and screenings. And we're looking forward to continuing to do an even bigger job with our 1,000 campaign this year. What is a cancer resource station? Provides cancer patient navigation services and support for cancer patients, survivors, and their families throughout their cancer journey, such as cancer information, resources, workshops, educational youth program, teen program, and more. You can schedule an appointment virtually, over the phone, or in person, as we said before. Okay. There are over 100 types of cancer. There are estimated 120,000 new cases in 2021. Okay. Some of the most popular that you might know as well is breast cancer, colon, prostate, lung cancer. But human papillomavirus that causes HPV causes 7 different types of cancer: vulva, vagina, rectal, penile, oral, cervical cancer, throat cancer, and some neck cancers. Now, studies have also shown that alcohol causes 7 different types of cancer as well. Time is of the essence. We cannot wait. How can oncology patient navigation help, which is also known as cancer patient navigation? What is cancer patient navigation? Now, the problem with our communities is that we don't even know what that is. As soon as you're diagnosed, that's the first thing you need to ask for: a social worker and a cancer patient navigator. Cancer patient navigation helps to eliminate the barriers of timely cancer care so the patient can focus on their health and well-being. From free services, which are resources, referrals, spiritual support for patients, family, and caregivers. What are barriers to timely cancer care? Financial, not having enough money to be able to afford medications, not having enough money to be able to get to the doctor's appointments that you need to get to. Fear, I'm scared that you're gonna die. Don't know what's gonna happen next. Health literacy, not knowing how the system runs, not knowing what literacy look like, what to expect, what can I expect from my healthcare facility, and what they can expect from me. A second opinion can help save a life as well. Having access to a second opinion. Lack of support, whether it be family support, community support, or whether it be the support of your medical team. Advocacy, being able to advocate for yourself. Let people know what you want, what you don't want, what you need to know about, and how to advocate for yourself is very important. Transportation, back and forth to your doctor's appointments, back and forth to your chemo or your radiation, back and forth to go and see about second opinions. And then we have undocumented as well. The fear of being undocumented and being having to be transported back to where you come from. You know, it's also a fear. Communication, the language barrier. Not understanding when you go. It's already as if they're talking in French, or they're talking in a foreign language when a doctor is speaking to you already. Imagine you really don't understand it at all. You know, so communication is very important, and grades level of communication. Not everybody went to college. Not everybody went to high school. So these are very, very important factors that are barriers to timely cancer care. Okay. With cancer resource navigation, patients will receive more timely diagnosis, receive more timely treatment, have access to free cancer resources, community services, screening, housing assistance, social services, research information, and more. Receive more information and education relating to treatment and cancer prevention lifestyle behaviors. More satisfaction with the healthcare system experience. Community support and spiritual support if needed.
Right.
Okay. We also have faith-based cancer resource navigators located in a few ministries, as well as in the Bronx. When it comes to the need for faith-based cancer patient resource navigators, according to the U.S. Centers for Disease Control and Prevention, CDC, 69% of cancer patients say they pray for their health. The Journal of the American Cancer Society suggests a link between religious or spiritual beliefs and better physical health reported among patients with cancer. The National Health Interview Survey found that 69% of cancer patients reported praying for their health compared to the 45% of the general U.S. population. Okay. When hospital patient navigation started back in 1996 with Dr. Harold Friedman, the only navigation that were going on in that very beginning was the navigation through abnormal results, diagnosis, and treatment. But what about outreach? What about rehabilitation? As we go along, it became more evident that these are places where we need to continue to navigate care as well. Well, our faith-based cancer resource navigators start with outreach. Within outreach comes free screenings, awareness, information and resources, referrals to cancer centers, cancer events, health fairs, community workshops. Then they're navigated to cancer centers or hospitals and patient navigators within those facilities for their abnormal results, their diagnosis, and their treatment. And then they're also navigated from the hospitals to faith-based navigators as well as community navigators through their survivorship, because cancer doesn't end because treatment ends. So through survivorship, there's spiritual support for family and patient, cancer support group, prayer group, information resources, education, free community resources, referrals, second opinion, provide health workshops, prayer partners, and prayer line. And ministries also navigate patients back for their annual oncology screenings.
Annual screening.
Why is it important for cancer resource navigation? With the cancer resource navigation, we do an intake service. Find out what the needs are for that particular person. Everyone have their own personal needs, whether they need a free or low-cost cancer screening, whether they might need a referral to a support group or a cancer life coaching or mental health, whether they might need grants and scholarships for themselves as a survivor or for their children. Due to the lack of funding, you're spending all your money in your medical care. If you have children, you want your kids to have a successful future as well. So we try to help and support them by providing scholarship information and grants information for the child as well as for the adult. The virtual, over the phone and in-person services really work out well. You don't have to come in. You can be seen. We can talk to you. We can talk to you virtually and right from in your own home for your own safety as well, if that's what make you comfortable. Navigate back to cancer centers for annual screening. We said that. Second opinions. We also navigate patients to clinical trials information such as Disrupt's website, the brochures, the information. We navigate you to clinical trials because we believe that knowledge is power, and knowing about clinical trials and resources about clinical trials is information and imperative for our community at this day and age. Also, we navigate our clients and patients to social services, housing specialists, assisted living, and home care services. And employment opportunities too, that wasn't listed there. What is passing the baton? To cancer centers or hospitals at a point of suspicious findings, screenings, diagnosis, treatment, and financial navigation assistance. That's what we pass the baton to cancer centers and hospitals for. We can't do that. That's why we need them to do that. And to cancer resource navigators located in faith-based organizations and community, we can navigate
Happen audio.
we can navigate clients too. Okay. So you
Yes,
hear me? Sorry. Okay. You can hear me now?
we can,
Okay.
or
All
I
right.
can.
All right. Almost done. Okay. Cancer centers or other medical facilities referring cancer patients or survivors to our cancer resource stations and resource navigators. So we are so lucky and feel so honored to have hospitals who are referring patients to us, to our faith-based navigators as well as to our cancer resource stations. What an honor and a privilege to be able to assist them and be able to have that baton passed on to us for resources and information that they're unable to give at that particular moment. Partnering with community-based organizations for services needed is a huge part of the success and the work that we do. For those patients that are interested in Cancer Life Coaching help cancer patients and survivors reach their personal goal while improving their health habits with knowledge of cancer information resources through patient navigation. Again, cancer is not over because the treatment is done. No matter how long your survivorship is, you're still surviving. And life is very important. And you should be able to accomplish the goals and reach the success that you would like to reach. And there's no goal that's too small, especially when you have a second chance to be able to talk about this and be able to share your stories with other people. So thank you so much for listening. Our training for ministries is 2 hours, a 2-hour training for faith-based organizations. And we also, that faith-based organization will be listed on our website. We have ministries on our website. We have questions that cancer patients can ask their doctors. We have medical terminology about different cancer procedures, if you're having CAT scans, MRIs, we have that listed on our website. We also have events, and we have different programs on our website about the resources and the different recreational activities and services that other organizations have on our website as well. So you definitely can go to that page and see if there's anything that's available in your community. Thank you so much for your time. Our website is SavedForLifeCancerCorp.org. It's not here, but that's what it is. And our number where we could be reached is 646-281-2234. And I'm in that. Thank you so much for your time. Thank you so much for listening. I know you got a wealth of information right now. So you got the research information, and then you got our Cancer Resource Station information. There's none like it. So if any way that we could possibly help, I appreciate it. Miss Allen has Miss Allen's link tree as well. Right, Miss Allen?
Yes.
Travis, this is Sandy. I will
Yes, Miss
speak to
Sandy.
you again. I will give you my address if you want to mail me the brochures, and then I will make
Okay.
sure that the office gets them.
Thank you. Thank you so
Sandy, this is
much.
Jeanette. I would love to get some of those brochures from my
Fine,
community
I will make
center
sure,
also.
Jeanette, we'll meet up somewhere
Thank you.
and we'll get them. And this way I know you got them and
Okay.
they won't be lying in the office. Is that okay, Travis?
Yes, ma'am, it is. Thank you so much. I appreciate you. Thank you, Miss Sandy. Thank you, everybody on the line. You've been amazing. Thank you for your time and your patience. And we hope that you won't never have to go through this, and that if
Thank
you have a loved
Thank
one
you so much.
or
Thank
family
you
Just
so
a
much.
wonderful,
friend who is
informative
going through it,
presentation.
please.
It was informative. It was
Thank
easy
you.
to understand. It was a
Thank
wonderful
you.
presentation with a wealth of
Thank
information.
you.
So thank you.
Thank you.
Thank you.
Thank you, beautiful
Thank you.
ladies.
All right.
Thank you. Everybody have a good night.
Wait a minute.
Thank you
Oh,
so
okay,
much.
fine.
Oh, it's okay. No, you want me to stay? No. I'll stay if you
No,
need me.
no. You guys can go. I just want, is there
Okay.
any new business or old business from our group? From our members?
No.
Because I have one question for the committee.
Okay.
Bernadette would like us to have someone speak on the poll project, with the Verizon, etc. My
Yes.
question is,
Thank you. Have a good
should
night.
we have
Thank
it?
you, guys.
Thank you.
Welcome.
Okay.
Thank you.
Should we have it? I thought more as a town hall meeting than a regular committee meeting like we just had. Is there any
That's a good
thought?
idea.
What
I agree.
A town
the-
hall.
Right. She wanted, all of a sudden yesterday, I got thing, and she said, "Oh, I thought you were going to allow them to make a presentation." I said, "No, I thought a town hall, so I will tell Jeremy and whatever. I personally think a town hall would be much better."
Agreed. I think
I
a lot of
agree
people
also.
might have opinions and questions and concerns that a town hall would be a more appropriate forum for.
Yeah, that's what I thought, but I just wanted your opinion. I didn't want to do anything,
Mhm.
out of the ordinary. I'm going to call Jeremy to tell him to stop, what's the word? Just to stop, the video. I don't think I could shut it off. Can I?
Sandy, I'm gonna email you the meeting minutes tomorrow, okay?
Oh, yeah, not a problem, Jeanette. And then once I get the information, we could meet up one afternoon and I could hand you some of the brochures.
That sounds good.
All right, my question is, does anyone know how to shut off the video? I'm gonna call Jeremy then. All right. Let me find out.
Oh, I know how to stop.
How do we do that?
I pressed on record. A thing came up. It asked if I wanted to pause or stop. Should I just press stop?
Yeah, great. I mean, we'll play around, but as long as it works. But I'll
One
call
last thing, let's just make it official. Meeting adjourned at 8:05.
Okay, great.
Okay.
Thank you,
Thank you,
guys.
Jeanette.
I'm having another presentation scheduled for next month, but I'm waiting till the beginning, or to the end of this month.
Sounds
Okay.
good.
Okay, I'm glad that you appreciated this one.
I thought it was excellent.
Yeah, she made it so
I
simple,
thought it
and
was easy to understand and it just was engaging and informative. It was excellent, I thought.
thank you,
Yes.
thank you.
Okay?
Yeah,
Everyone have
All
a good
right.
evening, okay?
Have a
Yes.
good evening, everyone.
All righty. Good
here.
night.
Good
Good
night. Bye-bye.
He burned out enough of my life. So I took off. But I'm telling the truth, I didn't touch Zinfeld.
Then who did?
I don't know who did. There was a van outside who was parked in the bar.